Maintaining good oral health becomes more than just a matter of keeping a nice smile. It's a critical part of overall health and well-being. For older adults, poor oral hygiene can lead to a range of serious problems, from tooth loss to gum disease or respiratory issues. Sadly, oral health is often overlooked in elderly care. Despite its close connection to nutrition, self-esteem, and systemic health, in this video, we'll follow the story of Mr. Johnson, a retired teacher navigating some common dental challenges.
You okay, dude? Jaw's been hurting for a couple of days. Actually, it might have been a week now. I don't know, just a throbbing pain I've been having. I don't know what it is, but this lower right here has been aching.
Well, Dad, I've noticed. I have also noticed that it's been hurting for a week. Why don't we go to what's his face, Dr. Smith? I think was your physician.
Yeah, but I don't really want to get out of this house. I've just been kind of avoiding it, trying to put a little numbing stuff on it. We'll see in a couple of days. How about that? You give me a couple of days, we'll see. If it ain't go down, we'll go see him.
Yeah, but what if it gets worse? What are we gonna do about that? We should just get it checked out so it doesn't get worse over time.
All right. You willing to drive me?
Yeah, I can drive you.
Sounds good.
Let's
I'll
go.
do that.
How's it going, Mr. Johnson?
It's going
Dr.
good.
Smith, nice to
Nice
meet
to meet you, Dr. Smith.
Cool, so I'm taking a look at your x-rays here, and it looks like you have like an early stage cavity on one of your back molars. I know you came in saying your jaw was aching. I think that could definitely be a cause of it, so I kind of want to just get some more information from you and see what's causing that early stage cavity and see the best way we can address it, if that's okay with you.
Sounds good.
Perfect, so according to this article on the AGS Journal, the prevention of infections in older adults, it's really important to brush your teeth twice a day with fluoride toothpaste, floss regularly, and stay hydrated to combat dry mouth. Are you doing all those?
Yeah, I brush morning and night, and sometimes after I eat, so I'm pretty good about brushing.
Okay, interesting.
But I do have a little dry mouth.
You do have a little dry mouth? So are you on medications for anything else?
Yeah, I take a whole bunch.
A whole bunch?
A whole bunch.
So taking a lot of different medications can actually lead to that dry mouth. That dry mouth and your older age can lead to reduced salivary clearance, and all that stuff causes a different type of bacteria in the microbiome, and that'll lead to those early stage cavities. So that could be what's causing you that pain. So I think the best solution for you today is we're going to apply silver diamine fluoride varnish to it, and then we'll kind of go from there. We'll have you come back in a few weeks, take a look at it again, see if that's working, and try to address it there. How does that sound?
That sounds good. I was really hoping not to get cut on today, so I appreciate a little preventive care.
That works, yeah. So preventative care is super important in our geriatric patients because it's important, like when you're on all these medications and stuff, it leads to other stuff happening in the mouth. So I'm gonna have my hygienist come in here. He'll talk to you about some other preventative care techniques, and then I'll come back in and we'll get that procedure taken care of. You have any questions for me?
No, sir.
Awesome. Thank you very much.
Thank you.
Hello, Mr. Johnson.
Hey,
I'm your hygienist. My name is Kevin.
Nice
so I
to meet
just got done talking with Dr. Smith. He told me you have great oral hygiene habits. You're brushing, which is great. You're flossing. You're using mouthwash. That's perfect. The only thing he told me to relay to you is that you should probably go see your primary physician, figure out what medications you're taking, and then you're gonna come back later and we'll figure out a diagnosis to see if that's what's causing your dry mouth. Before you leave here today, we're gonna put a fluoride varnish on these teeth that are hurting and all of the ones around, and then we're gonna have you leave with an oral moisturizer so that you can keep moisturizing.
Oh, that's great.
Okay?
Thank you.
Make sure you're staying hydrated, and make sure if you're using any mouthwashes, they're not alcohol based, because that could be drying up your mouth.
Okay.
That sounds fine?
Sounds good.
Thank you. Have a good rest of your day. Can't wait to see you in a couple
see you
weeks.
back. Yep, sounds good.
Today we follow the journey of Mr. Johnson, a story that reflects the reality of many older adults. At Mr. Smith's clinic, we learned about the essential role of regular checkups, daily hygiene, and preventative treatments like fluoride. This journey reminds us that preventive dentistry is not just about teeth. It's about preserving dignity, independence, and quality of life. With simple and consistent care of loved ones and professionals, we can help older adults age with comfort and confidence.